Hello and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County, and joining me today is Anna Martin, Public Health Director for Caldwell County. Welcome, Anna.
Thanks.
Anna, I ask you here to talk about all things COVID.
All right.
I know we get a lot of calls every day in the Emergency Operations Center, and a lot of those you answer yourself. So I thought we could try to address some of those questions today. So first we'll start with testing. Who should be tested?
Really anybody who suspects they may have COVID. So if someone has any kind of symptoms, whether it be congestion or a fever, headache, even nausea, they should get tested. They should go to their primary care provider or just get tested. Now, if someone has been in contact with anybody who's had COVID, a positive resulted of COVID, then they should get tested as well. We can test here at the health department, or they can go to the RDC and get tested.
At the health department, what's the procedure for being tested?
So we use the nasal swabs. And so if someone is interested in getting tested, they would call our nurse line, which is 426-8446, and they would fill out like a screening form for them and then make an appointment and come to the health department, just drive around the back, and then the nurse would go outside, talk to them for a little bit, and then do the nasal swab.
And how long does it take to get tests back?
Usually about 72 hours. Sometimes it takes a little bit longer, but usually within 72 hours we get results.
We hear a lot about people at high risk being tested.
Mm-hmm.
Who's considered at high risk?
So it's usually over people at 65, or they have a weakened immune system, someone who has a underlying chronic condition, or just someone who either has both or either or.
So after a person is tested, what should they do?
So once someone is tested, they really need to go home and isolate themselves from others if they're not an essential worker. So if they're an essential worker and they do not have any symptoms, they are allowed to go to work wearing a mask, keeping social distance. But if they're not an essential worker, they do need to go home for 14 days, just making sure to watch for precautions and watch for symptoms. So.
Okay, and we hear a lot about people who are symptomatic and people who are asymptomatic. So people who have symptoms and those who don't. If somebody doesn't have any symptoms but they test positive, what is the procedure for them?
Okay, so if someone does not have any symptoms and they test positive, they do need to stay home for 10 days. The starting date that they would look at is the testing date.
So they need to be at home in isolation,
Right.
basically.
Kind of away from people, just monitoring if they did get any kind of symptoms. So they would be released from the day that they were tested as long as they did not have any symptoms raised.
And what about people with symptoms? How long do they have to stay at home?
So usually if someone is positive and they do have symptoms, it's 10 days from the onset of symptoms, but they do need to be symptom-free whenever they're released, and 72 hours without a fever and any kind of medications.
Who releases the patients who test positive?
So in Caldwell County, it's the provider that does the testing. Not all counties are doing that, but basically in Caldwell County, it's the provider that orders the test.
So if the health department tested you, the health department releases you.
Right, and if UNC Caldwell does the testing, then they would release. Fry's the same way, crossing county lines, Burke's the same way. But in Caldwell County, if your provider does the testing, then they would release you.
We've talked a lot about people being in isolation.
Mm-hmm.
For some people, that is a really scary thing because they wonder, how are they going to get their groceries? How are their needs going to be met?
Mm-hmm.
How are their needs going to be met?
Right, so with the health department, what we do whenever we do have a positive, we call, we ask them a few questions, and at the end we do ask them if they need anything, whether it be groceries, they need medications filled, that sort of thing. And then it's passed on to a nurse who enters in all that information, and then it's on to someone else who would do monitoring. And then we monitor them every other day to see if they need anything picked up for them.
And here's a good place to ask. You do deliver food, medicine to these individuals. How are you doing that as a health department? Who's helping you with that?
Right. So the whole health department has really joined in, picked up, and everybody is all hands on deck with this. So really with the delivery, we've been asking animal control to help, environmental health to help. Everybody really, and a person from each department, just depends on how many we have. So if someone did need something like groceries, we really, a big shout out to Yoke Fellow, because they, no hesitation, they'll always get us a food box together, but the department will go pick up the food box and then deliver it to whoever needs it. So everybody really is helping one another.
And as we tape this, we have approximately 150 or so active patients that you're monitoring every other day. Mm-hmm. How many people do you have working on that?
The monitoring for needs, I want to think we might have about 20 or 25 people.
So it's a variety of people across the health department.
Right, yes.
Thank you for that. That's a huge thing that the health department's doing.
No problem.
Let's talk about a business, because we do have people who work who test positive. What do you tell businesses when they call in if they have an employee test positive? What advice do you give to them?
Well, we do ask them about their cleaning procedures, what they have currently in place. Usually if they do have someone that's positive, we tell them, okay, we ask them who's been their close contact. Who have they been around for more than 15 minutes to 6 feet apart, that sort of thing. Because those people would need to know they've been exposed to someone who's tested positive. So not only do those people probably do need to get tested, it is recommended, but we also do ask them their cleaning procedures of sanitation. What do you have in place? Do you need to close down a certain area? That sort of thing.
And in a business, the term the state uses is a cluster. Can you talk about what is a cluster?
Sure. So a cluster is basically what we know it as an outbreak, but a cluster is 5 or more people or 5 or more cases within 14 days. In some businesses, they may have like a few, but it ranges within a month or so. But a cluster per the state is 5 or more within 14 days.
And that's one of the times when it's kind of an alert, because there could be more spread there. It's just a way of saying, hey, we do have this number of cases, and it's just something we're looking at closely, so you can help the business better protect their employees, right?
Right, exactly. And so when we find out there is a cluster, we reach out to the company, which they already know that they have positives, because employers, have to know that there's a positive in their area. But we reach out to them, we ask them kind of what your strategies are, what you are working on, what you have going on, what the onset of the symptoms were, when was the last one, and what are your goals going forward. And sometimes we do site visits and that sort of thing.
And the same holds true. We talk about congregate living. I think people are more familiar with the term maybe nursing home or assisted living facility. That's some of the places you're talking about with congregate living. A lot of the same steps fall true with those places as well.
Right.
So, but now theirs, the state calls an outbreak, which is defined a little bit differently.
Yeah, so with an outbreak, it's 2 or more within 28 days in the congregate care, just because they're so close together. The state takes more action with the congregate care. So congregate care could even be a shelter home, a jail, nursing home, any type of business like that. And we would take the same precautions, except for it's a little bit more tedious, where we have to do a visit or just a scheduled call within 24 hours to see what their sanitation boundaries are and what they're working on and things like that.
So really you're coming along aside of business and supporting them.
Right.
Okay, we've also heard people talk a lot about contact tracing. What is contact tracing?
So whenever we have any type of positive in the health department for COVID, we assign that to our contact tracing team. And that person calls the positive person and asks them a lot of questions. Those questions might be, one from who's your employer, what do you do, to do you have any symptoms or do you not have any symptoms, when was your onset. It would also be from who were you around, when was the last time you were at work. If you didn't work, then who's your close contacts in your home. And then did you go to any kind of social gathering? Have you visited any of the congregate living places? The health department asks those questions to get more information to hopefully stop the spread, not to get into people's business or ask too many questions And I feel like that happens a lot when we call everyone. But the basic message from that is just to figure out who to tell them they've been exposed, so that either they can go get tested, stay at home, and reduce the spread.
And really, what can people do when they see that health department number pop up on their caller ID?
Definitely answer the phone. Definitely answer the phone, and we ask those questions. Please, please, please be truthful. I feel like sometimes when people call, they're nervous maybe to say, okay, I went to Walmart, or I had friends over at my house, but the more we know, the more that we could help.
And I know sometimes people are fearful of numbers they don't know or calls from strange places. What are some of the things that people who do contact tracing will never ask?
They're not going to ask you your social security number. They're not going to ask you very private details. They will ask you to confirm your address and telephone number and date of birth, but that's just to confirm on our end. But they're not going to ask you your social security number or anything like that.
We talked a little bit about your staff. Who's working on the front lines of COVID in Caldwell County?
I feel like a lot of people. For the health department, I want to say a majority of the staff, we're all front lines with this, and they're doing an amazing job. I will say we have a large team that's testing every day. It's starting to pick up to where we're going out in the community and testing a lot. We're testing a lot here at the health department. So I do have a lot of nurses and a lot of support staff that are scribing with them. They're a huge chunk of the front line, but then also have a lot of people that will stop what they're doing automatically and start tracing or keep monitoring, and they take that to heart, which is it's something that you can't find many places. So we're very fortunate to have that in Caldwell County. So I would want to say that everybody here is basically on the front line because they're doing some type of job that has to do with the pandemic.
Right, your whole department really, while they're continuing to do their normal duties, right. Animal control is still being animal control, environmental health is still doing environmental health, but in the downtime, right. They're delivering food or they're answering calls. So it really is a balancing act.
Oh, definitely. And everybody, they do it with a smile on their face. Sometimes they say, Anna's bringing you a gift. It might be a name and that sort of thing, but they don't mind at all. And environmental and animal control. And the reason why I'm saying they deliver using county vehicles and that sort of thing, and people that will know that that's what they're doing, that sort of thing. But other than that, everybody is willing to pitch in.
What can people do to protect themselves?
With COVID or just in general, the biggest thing is when you're out in public, keeping your distance, wearing a mask when you're out in public, always, always, always wash your hands. If you have sanitizer with you, that's great, but the biggest thing is just to always keep washing your hands.
What about for churches, places of worship? We know some churches are still doing services online, but some are starting to gather back in their wherever their church, the buildings. So what advice do you have for them?
So a lot of churches have done different things to social distance or to make sure they're keeping their congregation safe. So for instance, my church, I was very happy that they were doing this, but they did every other pew, and then all the families are together, but then they're also social distancing them too. So for example, they're still streaming, but they'll stream into the fellowship hall. So if it gets overfill of the sanctuary, you'll go in the fellowship hall and we social distance in there. But all the families stay together, making sure you're keeping your distance, sanitizer everywhere. You might want to block off different areas of the church and only have one area designated to services. And I think this is a time where we all kind of get frustrated and overwhelmed, but we always want to give someone a hug or shake hands, but I don't know if that's the best time, especially while this was going on. So,
if people have questions about COVID, about testing, where can they call to get more information?
Sure. So our Emergency Operations Center is open 24/7. That anyone can call, ask a question, or we can give it to the right person, but that number is 426-8605.
And we've talked about a lot of different things. What have we forgotten? What else do we need to include?
I think that might be it. I feel like we get a lot of questions in the EOC. But that answers really a lot of those questions that we're getting, just the basics of who can get tested and where can you go, and what to do. And I know this is one of those times where people are nervous and maybe even have some frustrations, but I think, the community in general is, we're all in it together is what everybody is saying right now, and I feel like our community is really knit.
Anna, thank you for joining us and
Yeah,
answering
you're
these
welcome.
questions today. And thank you for watching Caldwell County Today.